You are doing everything right. You take your medications, you're managing your diet, and you're resting when your body tells you to rest. And it keeps getting worse anyway. If that is your experience with Sjögren's, with long COVID, with any autoimmune diagnosis, there's a reason, and almost nobody has explained it to you yet. Hi, I'm Dr. Carol Wada, quadruple board certified allergy, immunology, lifestyle medicine physician. I also personally live with Sjögren's disease. So when I say I understand what it feels like to do what you think is everything right and still feel like your body's working against you, I've been there on both sides of the exam room. Today, I want to talk to you about a mechanism that sits upstream of almost every autoimmune and inflammatory condition, something that explains why so many of us have more than one diagnosis and why symptoms across conditions can look so similar, and why treatments that target individual symptoms often don't touch the underlying driver. You can save this before your next appointment, but okay, let's get into it. And a quick note, as always, these are for educational purposes only. We are talking about patterns that the research supports broadly and what I see clinically every day, but we're not talking about your specific medical situation or offering any medical advice in this context. All right, so what's the question that nobody's asking? Before I get into the mechanism, I want to frame the question that most appointments never ask. You have a diagnosis, maybe more than one. Your rheumatologist is treating one piece, your neurologist has another, cardiologist has their piece, but no one is asking why all of those pieces exist in the same body at the same time. And the answer is not just bad luck. The answer is not that you're unusually fragile. The answer is that there's often a shared upstream mechanism that is driving inflammation across multiple systems simultaneously. And until that mechanism is addressed, treating downstream symptoms often will feel like you're just one step behind. That mechanism has a name, and understanding it changes the conversation you can have with every other clinician then that you see. So, all right, in plain language, here's a version of what's happening inside your immune cells. Your immune system has a security alarm built into nearly every immune cell in your body. Its job is to detect threats, infection, cellular damage, toxin like a bee sting, something that should not be there, and then fire a warning signal that mobilizes the immune response. When this alarm works the way it's supposed to, it fires, the threat is neutralized, and the alarm turns off. Researchers call that alarm the inflammasome, specifically NLRP3 inflammasome. That's the technical name. What matters for you is what it does and what happens when it malfunctions. When the inflammasome fires, it releases two powerful inflammatory signals, and these signals recruit immune cells. They drive inflammation and in some cases trigger a form of cell death designed to eliminate the threat. In a healthy immune system, this cascade is life-saving. In Sjögren's, long COVID, rheumatoid arthritis, lupus, and other autoimmune conditions, the alarm doesn't always turn off, and it keeps firing. And that inflammatory signal keeps releasing, and the downstream effects, glandular damage, fatigue, pain, brain fog, nerve symptoms, cardiovascular risk, that's what the patient experiences as the disease. This is not a new idea in immunology, but it is one that has taken a long time to reach the conversation happening in your rheumatology, your immunology, or even allergist office. And that gap is exactly why so many patients often feel like we're still chasing the symptoms, right? So how does this connect all these different conditions? Things like Sjögren's, long COVID, autoimmune disease in general, they all can look pretty different. Different diagnoses, you see different specialists, there are different labs that may be, abnormal or all normal. They have different names, but at the level of the inflammasome, they do share some similar physiology, and that is that often they are stuck in alarm mode. In Sjögren's disease, dysregulated inflammasome activation occurs in the salivary glands and the lacrimal glands, so the saliva and tear glands. This same immune mechanism driving dryness is also contributing to fatigue and nerve symptoms, the cardiovascular risk, and systemic inflammation that most of us are carrying without anyone really connecting the dots. Now, in long COVID, the research suggests that the inflammasome is implicated in the persistent fatigue, brain fog, and autonomic dysfunction that often mirrors, what Sjögren's patients experience too. A viral trigger activated that alarm, and in most people, the alarm reset back to normal, but in long COVID, it didn't, and the result is a pattern of symptoms symptoms that is functionally pretty similar in many cases to what a newly diagnosed Sjögren's patient may experience. And we have seen that many long COVID patients may eventually receive an autoimmune diagnosis. There is an increased risk of those things tracking together. Now, in rheumatoid arthritis, in lupus, and gout, the inflammasome connection it has the most established basis of their research. There's been more funding, we're looking at it. It's looking at that same pathway, that same signal that's stuck in the on position in the same downstream cascade of inflammation that ends up having ripple effects across multiple systems of the body. This is why so many of us end up with more than one diagnosis. And in addition to kind of other aspects of this disease that overlap, like there is this perfect storm that really does occur in many different ways. And, it's not necessarily that we're unusually unlucky. It's just that we can see these misbehaving immune mechanisms, immune dysregulation in the context often of barrier dysfunction and a microbiome that's off kilter and some metabolic and hormonal issues. Like it all comes together in this big mess of physiology. So let me explain a bit more about why the alarm stays on. This is where lifestyle and environment become more genuinely relevant. Now, not as a substitute for medical treatment, but they are levers that can affect the overall terrain where all of this is happening. See, the inflammasome needs two signals to fire. The first signal is priming. So something puts the immune system on alert. Perhaps it's a past infection, it's chronic psychological stress, a disrupted gut or skin barrier, environmental exposure. This signal essentially loads the gun. And the second signal pulls the trigger. Cellular damage, mitochondrial dysfunction, ongoing microbial signals from a disrupted microbiome, reactive oxygen species from a body running on a chronic immune inflammatory response. In autoimmune disease, both signals are chronically present. The immune system has been primed by something often years ago, and something in the current environment tends to keep pulling that trigger. And the alarm never gets the all clear signal, it needs to stand down. So what does this mean practically? So we can address the second signal, and often we can do that with some lifestyle interventions, and they have a meaningful role. Not because any single change cures an autoimmune disease, but if we're able to reduce mitochondrial stress, support barrier function, stabilize circadian rhythm, manage our nervous system's threat response, that all affects how often that second signal fires. This is terrain work, and it sits alongside, not instead of, medical treatment. Often can be super supportive. Now I want to tell you what's coming because this section matters. The research community has identified the inflammasome as a target, and there are a new class of drugs, NLRP3 inhibitors, which are designed to turn off the alarm at the source and at that switch itself. Next generation compounds, including one called inazomelid, which I may or may not be pronouncing correctly, are in clinical trials now. If they work as they did in preclinical data, they would simultaneously block the entire downstream inflammatory cascade in a single intervention. That is potentially more comprehensive than anything currently approved for autoimmune disease. Now, these are still super early. They are not available at your pharmacy, but it is something that's in trials. And it is the first time the research community is targeting this shared upstream mechanism rather than an individual symptom or mechanism downstream. The reason this is worth knowing now is even before these drugs are approved, understanding the mechanism changes how you can talk with your care team. This helps you have a more informed conversation about inflammasome-driven inflammation by name. You can ask whether your current treatment plan is addressing, immune dysregulation. These are not abstract questions, and they are the questions, though, that can move the needle and really increase the depth of that 15-minute or 20-minute appointment. These are the kind of conversations that continued at the 5th annual Sjögren Summit, talking about the pipeline, what it means for Sjögren's patients right now and for the next 5 to 10 years. If you miss the live sessions, the encore window is still open. You can still catch those sessions for free. The link is in the descriptions. Okay, 2 things to do today. Concrete, doable this week. The first is to bring up the inflammasome at your next appointment by name. You can say, hey, I've been reading about the inflammasome and autoimmune disease. Are we doing anything to address it? Most rheumatologists and immunologists are going to know what you're referring to. Maybe you can nerd out a little bit together with them. It signals that you're tracking the research. It opens a different kind of conversation. The second is to look at the modifiable factors that prime the alarm in your own life, not to replace your medical treatment, but to work alongside it. Barrier support, sleep consistency, nervous system regulation, mitochondrial support through targeted nutrition, pacing. These are the terrain levers. They affect how often the second signal fires, and they are within your reach right now, just with small adjustments to your everyday habits. Before I send you anywhere, I want to say this directly. If you've been doing everything right, you feel like you're still getting worse, you are not wrong to keep looking for the missing piece. Because there was one. The research has been building towards it for years. And the fact that most appointments never mention the inflammasome is not because it's not real. It's because of the gap between research and clinical practice. It's measured in years rather than months. You were ahead of the system, and that's not comfortable, but it's true. And now you have a name for the mechanism, a framework for the conversation, and a pipeline to watch. So save this video, send it to someone who's been told their diagnoses don't add up, or that their symptoms across conditions are just bad luck, because they're not bad luck. They're misbehaving immune alarms, and that changes everything. If this is the kind of content that helps you, subscribe. That's exactly what this channel is for. We have new videos every week. Science blacked, a little bit of fluff sometimes. And until next time, I'll see you in the next one.